Good morning, everyone. Thank you for making the time to join. My name is Alex Carrillo. I'm the CEO and founder of Alcar Health, as well as a founder of FQintel. With me today, I have Robert Cuadra, who's our CTO and COO at Alcar Health, and who is really the architect and the brains behind building FQintel. He's on the call to help answer any questions along the way. And really today, what we wanted to do is share with you guys what we've done so far in building FQintel, what we have today, and what's coming down the roadmap. So I have a quick slide to show you guys. I promise you it's only 5 slides. I'm not going to bore you with a bunch of stuff. And then we'll jump right into the demo. After that, we'll open it up for questions. But like Natasha said, if you have any questions, feel free to drop them in the chat. Happy to answer those questions. So just a little bit about FQintel. We call it the intelligence platform for FQHCs and the organizations that serve them. We know on this call we have quite a few vendors that work in the FQHC space. So we really built it with that in mind, as well as the FQHCs and PCAs. I'm going to go through the deck here. So a little bit about us, just so you know who Alcar Health is. We've been in the space for going on 16 years now. October's our anniversary. We have primarily focused on being an advisory firm, and we have built a network of vendors that we bring into FQHCs to deliver solutions. And what we've done over the years is we've always tried to go out and find the data that's out there to make our conversations with the FQHCs more engaging and relevant. So what we used to do, and I say used to because after FQintel we don't do this anymore, is we used to go out there and go to the HRSA website, go to find the 990s, do a bunch of other searches, and try to gather all that data together as we were engaging with FQHCs. And then fast track to now, with Robert's help and the team's help, we said, hey, we need to develop a platform that can do this more effectively to make our efforts more effective, and we're not wasting time doing that kind of work. So our work at Alcar Health is servicing FQHCs, identifying challenges, bringing partners that can solve those challenges, and that's what spun off FQintel. So a little bit about what you will find inside of FQintel. And again, this is about 20% of our entire roadmap as of today. So in FQintel, you will find the IRS Form 990s. If you're not familiar with those are the tax returns that the FQHCs file. Those tax returns are public, so you can find those. I'm sure everyone on the call is familiar with the UDS and HRSA data. We've ingested that. We have audit filings as well. And from the 990s, we lift the vendors and officers information into the platform. So these are really the 4 core data sets that are in the system today. So what do? We pull from the source. We normalize the mess, because if you've ever gone out there and tried to download the Excel sheets and do this yourself, you understand that the data is not always 100% clean. So we normalize it, we connect the dots, right? So we take the 990s, we take the HRSA data, we take the officer data, the compensation data, we ingest it all together, and we make it usable on our platform for our users. What we've done is we built the platform to give access. We don't sell files, right? We don't sell data. Really what our business is in providing the platform. The data is 100% public. You can go out and grab it yourself if you want to take the time. And one thing I like to make clear all the time, because we get this from vendors, is do you have contact data? Do you have emails, phone numbers? We do, but we do not publicize them on FQintel. We're not in the business of selling contact information. There's other companies that do that well. Apollo, Zoom Info. So if that's what you're looking for, I highly recommend going to those vendors. That's not what you will find in FQintel. All right. So this is FQintel. This is what the platform looks like today. It is getting a revamp. So in about 45 days or sooner, you'll see a whole new look, but this is what the platform looks like. This is what our clients see today when they log in. On the left side, you're going to see a little bit of extra menu options, because this is a super admin account, but typically you're going to have 4 areas. You're going to have health centers, vendors, auditors, and highly compensated. You will also have recently viewed notebooks and shared notebooks, and I'll go over all of those. So we'll start with health centers here. And as you can see, you'll see the UDS data, 990 data, audit data, geography, and what we have here is also metric trends. So you can search by trends. One of the things you'll notice is that as you click these different options, the searches change down here, right? Which allow you to do custom searches based on that data set. So I'll give you guys a quick example. The other thing you'll see here is tiers. We do tier all the FQHCs based on the total number of patients. So tier ones for us is anyone with 100,000 patients or more. Tier 2, tier 3, tier 4, tier 5. So if you're going after tier ones, you'll see there's about 42 FQHCs in the country that have over 100,000 patients. But let's narrow it down here and then dive in. One of the questions we also get is, hey, do you have the 2025 data in there? Yes, the 2025 data is in the system today. You can search it. You can use it as of today. If you wanted to do more of a deep search and using the 990 data, you will go here, add a filter, and they'll tell you what data set do you want to search. Every single HRSA data set is in here. So if you wanted to say, hey, show me the FQHCs that have greater than, let's pick a different one that's a little bit more unique. Let's say Medicare, let's say Medicare patients. Let's say you're targeting FQHCs that have a certain number of Medicare patients greater than or equal to, let's say 20%. When you do that, it'll start to digest who those FQHCs are and show you the percentage. So it shows that there's only 2 in the country that are tier ones. But if we go to all tiers, it will show you there's 307 FQHCs in the country with 20% or more Medicare patients. So when you hold this, you may say, okay, well, this is great, but how many Medicare patients are there? You can go ahead and add that column, and now you can see the percentage and the total number of Medicare patients. So I won't go too deep into it, but you could do combinations of these searches, right? So I'll show you one, right? So let's say you have 307 here. You say, okay, well, that's fine. I want you to only show me the ones in, you can search by zip code, you can search by city, address, you can search by state. So for this, let's just go ahead and search by state. Let's say California, because we know there's quite a bit in California. And then they'll start to narrow down. They'll say, hey, based on your search, there's 19 FQHCs with 20% or more Medicare patients population. What their total Medicare patient count is, this is using 2025 data, total number of patients, total revenue, total sites, average percentage of Medicare patients. And in that cohort of FQHCs, there's a total of 57,916 Medicare patients in these 19 here. So what this allows you to start to do is allows business development outreach research teams to start to create notebooks and save these notebooks that you can actually share with someone along the way. So your notebooks will appear here. These are all saved searches. And then any shared notebooks that anyone shared with you inside of your organization will appear here. These are all custom searches. I'll show you one to give you an idea. I always like to show this one because it's pretty unique. This is an FQHC. This is a vendor that came to us and said, I would like to target the FQHCs within 50 miles of 91020 in California that have over 1,000 Medicare patients and their A1Cs are trending upwards in the last year. Pretty specific search, we were able to identify 15 of those FQHCs, total number of diabetic patients, the distance from that zip code, total patients revenue, and the percentage of diabetic A1Cs, how they've been trending up at the last year. I'm going to switch for a minute and I'm going to show you what an actual profile looks like of an FQHC. I always use our friends at Ultimate because everyone knows who Ultimate is. So you can see Ultimate's a tier 1, total patients 312,000, 1.7 billion in revenue. And you can click here. And now we're going to dive in to look at the profile of Ultimate. There's quite a bit here. So depending on your role, you're going to look at different things. If you're interested in the finances, you're going to see their finances here. I'm going to close this out for a minute here. And you'll see their revenue, expenses, net income, assets, net assets, total number of employees, other employee benefits, fundraising gross receipts, fundraising net income. These are very unique information. Some of these FQHCs don't have this, right? But does the FQHC have a collection of art? Do they have a foreign office? Or is there lobbying activities that for very specific use cases? The question always is, well, how are you getting this information? If you see here, this is the 990. This is a tax return. So you can just click on that tax return and you can verify the information because the information is lifted directly from these tax returns, from their 990s. Every page is in here. This 990 happens to have 101 pages. So it shows you all their financials, which if you remember, you can do that search if you wanted to say, hey, show me the FQHCs that have a net income above 5 million, or show me the FQHCs that are losing money in the specific region. You can do that search. You can also search for compensation and salaries. This is important for a number of reasons. Sometimes FQHCs are using this to compare compensation to other FQHCs in the area. How should they compensate their executives and so on? And we have all their compensation for the executives that they list here. And if you wanted to do this, you can actually see their compensation for each of those individuals year over year. This one goes back to 2020. Once the 2025 financials are uploaded, it will get shifted. It'll go from 21 to 25. I'm going to continue to go down. This is an area where we get a lot of interest from, especially vendors. So in the 990s, FQHCs are required to list their top 5 vendors that is paid $100,000 or more to in that specific year. So doesn't mean those are the only vendors. Any vendor that they spent $100,000 or more to, they are required to list them. So as you can see here, there's a total of 19 vendors. Now you're going to see that on the right side, and it tells you the services. On the right side, you're not going to see any amounts because this is only for 24. So you're only going to see amounts for 5 of these folks, right? However, if you go and you open up another tab, you can see year over year the amounts for each of those. And has it been for 1 year? Has it been for multiple years? And what those amounts have been, right? One of the ones I like to look at here, let's see, Henry Sheen. I'm going to pull them up because people know who they are, right? So I can click on Henry Sheen, and now I can see Henry Sheen shows up and 4990s. I know the FQHCs, I know the states, and I know how much that Henry Sheen has been paid from the FQHC for that specific year. Why is this important? If I'm a competitor of Henry Sheen, I can see who they're servicing. I can see how much they're paying. And if you wanted to, you could say, okay, well, this is great, but I'm not familiar with these FQs. Like how who are they? How big are they? I see the name, I see the state. If you wanted to get the total number of patients, you just add that column and you could see it right here. All right. And then you could sort up, down, however you want to do it. That's the vendor side. I'll take a pause there and see if there's any questions.
Do you have any publicly available UDS data or the full UDS data set? I mean that tables 5, 8, 8, and 9D are proprietary tables, and not all of the health centers publish their data in those tables.
Great question. As of today, it's all only public data. We don't have those additional tables yet. That is in the process, but we don't have that today. Any other questions?
That's the only one right now, but if anyone wants to drop another question in there, we'll get to those as well. But Alex, if you want to continue.
Sounds good. All right, I'll go back here. We were looking at the vendors. For some organizations, this might be important, right? If the FQHC is giving grants or other assistance to anyone, you can see who those organizations are, the amounts they're for. You can search for it by year. I won't get too deep into this one. Expense categories. I believe this could be very important for a lot of people servicing FQHCs. Again, you can see it year over year, how they've listed, they being the FQ, of how much you're spending in each category. So these are the expense categories for that FQ. And go back here, scroll down. Payer mix. This payer mix comes directly from their audits, right? So depending on how the FQHC reports their audits, as you probably are aware, every audit document is different because it's prepared by different firms. So there's not a standard way of the audit. However, the information that you see here of the payer mix is whatever the FQHC listed on their audit. You can also see 340B revenue. So if you were interested, you're in that space of the 340B and you want to see, well, what's the revenue that FQHC is getting every single year? You can see what the revenue is and you can see what percentage of the total revenue is for that organization for that year. If you wanted to look at the audits, you can see the year, you can see who the auditor is, their federal expenses, and then based on the AI, is this considered a low risk or a higher risk? All of these are considered low risk. If you wanted to look at the audit, you can pull it up, look at the audit. They're all in there. All their health centers are listed here by location, and they'll tell you, is it administrative or is it a service delivery site? Some folks like to go in here and kind of dive deeper. Let me see if I can go ahead and service delivery site. And let's say for some individuals, that is important, right? Like the health center number, geographic information, who's a U.S. representative, congressional district, senator, things of that nature. If that's something that's useful to you, the data is in there. Lastly, for the profile, this is where all of their HRSA data is listed. And if you're familiar with going to HRSA, very similar. The difference is we have it all in one table versus clicking back and forth in different tables. That's number one. Number two is trend it. So you can, and we show the trends of the 1 year, 3 year, 5 year, which doesn't, you don't have to go do that math yourself. And every single data set is in here. You can also pin information. So there's about 130 data sets in here, but obviously you may only care about a few. So you can pin the ones that you care about and then just say, show me my pin metrics only. And then it will only show you the ones that you care about, right? So if you were in the Medicare Medi space, this is probably what you're looking at. Mental health patients, this is what you're looking at. And again, going back to the searches, this is all part of the search. So if you wanted to search, show me all the FQHC that have a percentage of mental health patients above 30%, or show me the ones that are declining in their mental health by region, whatever it is, you can do those searches. That's really a high level overview of the health centers. I'm going to jump into vendors. You guys got a little bit glimpse on the vendors area. This is our vendor section. Every single vendor that shows up in the 990 is listed here. There's a little bit over 7,000 vendors. One of the things I have to be very clear about is that the data that's lifted from the 990s is exactly how it's listed in the 990s. What does that mean? That means that sometimes there's typos, right, in those 990s. So some of the names may not be 100% accurate. And I'll try to give you an example here. I'm going to try to not use someone that's on the call, but I'll use our friends at Factor, right? So Factor Health, very well-known consulting firm, mostly in California. You can see here, if I just put Factor, it's going to show up multiple factors, right? Why? Because the FQHC lists them in different ways. Some of them say Factor and Associates LLC, Factor, Greg Factor. You get the point. Even the services they list are a little different. But ultimately, you'll get a snapshot of how many health centers they serve, what the total billings are. And if I go in here and click on it, I can see who are those health centers that they're serving and what were they compensated for in that year that they put in the 990s. Well, I'll go back. So you can search by a specific vendor name. You can search by services. You can search for a specific year or all years. You can search by billing amount. You can search by health. However you want to digest the data, you can do that. So I'll give you an example. Let's say you're looking for call center services. You're going to notice there's different ways FQHCs list the call center services. So you can select a few of them. You can say, hey, show me call center provider, call center services, right? You get the point. So I selected 6 of them. It shows me the services and it shows me all the vendors that show up, total health centers, total billings. I'm going to move, that's a quick overview on vendors. I'm going to move to auditors. If you're in the financial space and you want to see who's auditing who your comparators are, or you're an FQHC looking for a new auditor, you can do the search here. You can search by specific name, or you can simply look at the auditors listed here. You can see the number of health centers they've audited, the number of audits, the year ranges, and there's about 761 auditors. Same applies as vendors. Some of the names are similar, not 100% accurate, right? So Forvis Mazars, and this one's listed by the most to the least, right? So if you want to look at Baker Tilly, you click Baker Tilly, you can see all the health centers and for which years they've done the audits. So again, if you're in that space and you're looking to see who your competitors are, who you may be able to win some business over, this is a great tool to do that. I'm going to cover highly compensated. This may or may not be relevant to the audience today, but if you are a recruitment firm, staffing firm, whatever it may be, this could be a very, very powerful tool because you can search by employee, you can search for a specific name, you can search by a specific health center, or you can search by a specific state and even a county. So I'm going to do CFO, and I'm going to just say California. So there's 258 results that show up for CFO in California. So if I'm trying to build out a model, if I'm trying to recruit and I'm trying to see what's the average payout there, this gives me a good idea. If I want to narrow it down and say, hey, this is for LA County, then it's going to narrow it down. There's 108 CFOs in LA County, what their reported FQHC compensation is and total compensation. So you may be asking, what's the difference between reported and total compensation? Robert, I'm going to let you answer that question since you're the...
Yeah. Well, if you just hover over that tooltip, it'll give you that explanation there. So there might be related organizations to the FQ that also provide benefits to that FQ, whether it's a parent or another type of organization that does compensate. Oftentimes it's it's going to be the executives and the executive level medical staff that you see getting what they call, quote, other compensation.
Yeah. So keep in mind, this is showing multiple years. So if I want to narrow it down, say, hey, just show me 2024, because I understand that maybe not everyone has filed their 2025 taxes, then it's going to show you for 24 only, right? And some of this, and Robert, I'll let you talk to the fiscal year as well, because that could be a little confusing for some folks. So if you want to jump in and share that.
Yeah. So some organizations, they don't run on a calendar year for their finances. They may, as you see in the first row there, their fiscal year ends at the end of the second quarter. So there's a fiscal year and there's a tax year. So because it was ending in 2025, it's actually considered their tax year 2024. It does get pretty confusing. We try to use a flat year when it comes to the detail page for each of the health centers. But I mean, if you understand that part of finance, it makes sense. If you don't, it can be a little bit confusing.
Yeah. This is a great way. FQHCs are using this to figure out how they're going to compensate their executives, whether if they're recruiting and so on. So great tool to look at compensation across the board. So we've gone over health centers, we've gone over vendors, we've gone over auditors, highly compensated. I showed you a glimpse of the notebooks. Again, these are custom searches really that you build out and you save and you can search. And then the shared notebooks are really the searches that someone else did, and they're sharing that search with you. So once you customize it, you build out your filters, you could save it. You don't have to continue to run those filters every single time for any of your use cases. That is what FQintel is today at a very high level. I want to be respectful of everyone's time. The common questions that we get right now are, hey, can I export some of this data? The answer is yes. In the next 30 days, you'll be able to export some of this data for our annual users. For our monthly users, exports are not available. So that will be available. There are other data sets that we are working on. Again, this is 20% of our roadmap, but we've launched this. It's working well. We have quite a bit of interest. We have some vendors on it. We have some FQHCs on it. So I'll stop there and see if there's any questions.
And for the questions, you can drop them in the Q&A or feel free to use the chat function as well. Also, while we wait for any questions, we will be at the CHI conference next week doing demos. So if you'll be there, please let us know, or someone from your team, and we can meet in person and dive deeper into the platform as well. Alex,
Awesome.
It looks like we have a question. What is the other 80% of your roadmap plan for future data sets?
Great question. Robert, you want to touch on that a little bit? I don't
Yeah, I mean, there's a lot, right? I think one of the ones that we're going to hit pretty soon is the PPS data. So we want to get that ingested. We're probably going to start with California because we do have access to that data set, and then kind of move across the different states as we're able to get our hands on that data. Another one is starting to include census data, CMS data. We're going to ingest the NPI information because we want to start associating. We also want to ingest NPIs because we want to ingest providers as well and start associating providers with the different health centers. And what else? We haven't really gone too deep on the paid claims data. I don't think we have any plans in the near future to touch that. Other organizations do that and they do well at that. That's not where we're looking to differentiate. But yeah, off the top of my head, those are the 5 or so data sets that we're hoping to bring in fairly quickly.
I'm looking for our list of our roadmap here and see if there's anything else we can share with you guys. Yeah, I think the ones that Robert touched on are definitely the main ones. We will obviously, it'll have a whole new look and feel in the next 30 to 60 days. All right, I found it here. So, there's one thing I didn't share with you guys. Let me just share this real quick. For some of you guys, this might be useful. Let me just jump in here.
Oh, sorry, there was one more data point that I'd like to ingest, and that's ingesting all the job openings for each of the health centers.
Correct.
Try to understand where their gaps are, and I think that's definitely valuable for our vendor clients.
All right, I think I see another. I see a question Q&A. Is this a subscription model? It is a subscription model. And if that's something you're interested in, let us know. Send us an email and we will send you our pricing. If you're a CHI, we are going to do something custom for the CHI attendees. So let us know and we're happy to give you a special rate on that. I'm going to show you guys one. And just so you know, we do monthly and we do annual. Obviously, there's different benefits to both. Okay. So I'm going to use our friends at Golden Valley. And this is something that some FQHCs really like, as well as some vendor partners. So let's say I wanted to compare Golden Valley to community medical centers in Stockton, just because they're kind of in the same area. This will do a side-by-side comparison of all their data, right? So I won't bore you with this, right? But it will show you all their 990 data. I'm going to collapse this. It'll show you their financial data, compensation data, officer compensation, if you want to get into that. It's, I'll highlight which one gets paid more depending on the title, top vendors. You can do that. So it pretty much does a side-by-side comparison of all their data set. Very similar, like if you're comparing a product online, right? You're trying to see the difference. You don't have to put it into a spreadsheet. It does it for you in one view. The audits, the pharmacy revenue, right? So you can see, hey, pharmacy 340B, these guys are making 5.3, these guys are making 11.3. What's the percentage of the total revenue? Payer mix, all of that. It's a side-by-side comparison of those FQs. Site counts, 52 versus 42. So it's a pretty useful tool for depending on your use case. Let's see here. Awesome. Thank you for answering this. Very helpful for the census and CMS data. How do you plan to connect that to FQs? Will there be anything geographic profile, demand, and opportunities by service area? Robert, I'll let you answer that one.
The answer is yes, and that's why we want that census data. We do want to pull in grant data as well, specifically if we can get our hands on grants that were actually approved or successful. We want to understand what the successful grants have in common versus the ones that weren't. But yes, we also are looking at pulling in the unmet needs data from HRSA. So that all kind of ties together with the service areas, with the census data, and being able to put that into one picture for our FQ clients to be able to more quickly do the research for their grant applications.
Thank you, Robert. Any other questions? If we don't have any questions and you're interested in any of the information, again, send us an email. If you're a Chai, we'll be there. We'll see you this weekend. Let's see. Oh, thank you. All right.
Alex, one thing, and I know we went into is that the trends and kind of seeing that across the FQs, which I know a lot of our clients use that tool. So if we wanted to maybe show that, if anyone, or we can go deeper in further demos, but I thought that was a good tool that we've used before as well.
Yeah, I can do a trend search. Thank you, Natasha. If you guys don't mind stick around for 3 more minutes, I'll show you guys what Natasha's referring to. So I'm going to go back to health centers, and we're going to go here based on metric trends here. And let's just say we say, hey, I want to find out, I'm going to use Medicare again, just for the sake of it. So in this case, I'm saying from the UDS data set, based on Medicare patients, in the last 3 years, show me who have been increasing their Medicare patients. So it takes it down from about, I think it's like, what is it now, Robert? 1,500 FQs, 1,500. Well, that's the other thing. There's FQs and lookalikes, but from 1,530, it's down to 978. And it starts to show you the trend of how their Medicare population has grown. And if you want to narrow it down and say, okay, out of those, I'm going to do 2024 because not everyone has filed their 25 taxes. Say, show me who has a net revenue of greater than or equal to $1 million, 349. And you could do the reverse, right? You can say less than or equal to $1 million. So who's growing in Medicare and losing money? This is your list. There's 502. Okay, well now narrow it down to a specific state. I'm going to pick California again just because they're our neighbors. There's 59. So in California, there's 59 FQHC that their revenues was under $1 million in 2024, but their Medicare population has grown over the 3-year period. And it tells you what that data set is here. And you can see this as a notebook and come back to it later if you like, or share it, whatever it may be. So Natasha, thanks for bringing that up. I hope you guys see some value here. Feedback, anything, we always welcome it. Again, this is just the beginning. We will be launching new updates. Updates come out probably almost every 2 weeks. So if you jump on the platform, you start to see new things approximately every 2 weeks as we make progress here. So thank you, everyone. Have a good one.